around, and there were 500 puzzle pieces all scattered around the waiting room floor. Wow, we had made a mess. My cousin and I were jamming together the pieces of the puzzle to pass the time until my dad's name was called, forcing us to abandon our unfinished work. My cousin pulled me into the waiting room to see my dad. I embraced him, careful to not disturb the forest of wires or the bandages that were wrapped around his head. I was naive, being more preoccupied with the mess I had left behind in the waiting room rather than my dad having experienced his 9th major concussion as a professional athlete. At 10 years old, I was confused by the uncertainty in the doctor's voice when he was relaying updates about my dad, as I had seen these physicians as all-knowing and all-curing superheroes. What was so wrong with my dad's head that even the doctor couldn't understand? In today's society, we tend to overlook the ramifications of head injuries simply because there's usually not as much gruesome visible exterior damage. There's even an allure to watching professional football players clash their heads together or watching a boxer sock someone in the face and knock them out. Now, I don't have anything against televised athletics. My dad is a professional cyclist. He's been one of the top cyclists in the nation for his career that's lasted 18 years. He races about 50 times a year, so that's a total of over 1,000 races in his lifetime. He's placed on the podium at the state and national levels and even competed at the World Championships 5 years in a row. Unfortunately, as a cyclist, crashing is part of the sport, and my dad is no exception. Thankfully, my dad has seemingly recovered from every one of his major crashes or injuries, even the ones where he hit his head. However, in the past few years, things began to change. He started getting mood swings. He can't really control his emotions at times. He has frequent seizures and collapses. Sometimes he slurs his speech and forgets where he is, similarly to how a dementia patient would. How does a perfectly healthy professional athlete start experiencing these symptoms at the tender age of 49? My dad isn't the only athlete who's experienced these types of problems later on in life due to a history of traumatic brain injury. The first post-mortem pathological brain study that showed the correlation between concussions and lifelong impact was that of Mike Webster, a former NFL player for the Pittsburgh Steelers. Mike Webster was extremely accomplished. He was in the Pro Football Hall of Fame and competed in 4 Super Bowl championships in his lifetime. However, in the last few years of Webster's life, his personality and behavior began to change dramatically. He abandoned his wife and kids and started living out of his van. He couldn't sleep at night, so he would use a taser to shock himself to sleep until he could. He even started pulling out his own teeth until he eventually died of a heart attack in 2002. Now, this man, he had a wife, a family, friends. By the end of his life, he was completely unrecognizable. After Webster's death, Dr. Bennett Omalu, the forensic neuropathologist that performed his autopsy, saw all kinds of damage in his brain. In fact, studies today show that the cumulative damage to Webster's brain was equivalent to that of over 250,000 automobile crashes. Webster wasn't an isolated incident. Several years after his death, fellow NFL players Justin Strelzik, Andre Waters, and Terry Long all followed. Dr. Omalu found the same type of damage in all of their brains. After finding convincing evidence of the link between concussions and experiencing dementia-like symptoms later on in life, Dr. Omalu gave his discovery a name: chronic traumatic encephalopathy, or CTE for short. Now, the brain, it's a soft and squishy organ that just floats freely in fluid within our skull. When an impact is sustained to the head, the brain hits the skull and gets damaged. This is called a concussion. CTE is caused by these concussions or even multiple seemingly benign subconcussive traumas. CTE also causes rapid brain degeneration over a span of 5 to 10 years, usually starting in one's 40s or 50s. While it's unknown what exactly triggers the start of this deterioration, it could be years or even decades after the initial injury. The tragedy and difficulty is that there is no cure for this progressively degenerative condition. There is no ability to undo the constantly worsening damage to the brain. What starts off as forgetting your keys can eventually spiral into forgetting your own brother's name. Additionally, there is no way to effectively detect or even diagnose CTE until a postmortem autopsy. As of right now, doctors can only do it by a case-by-case basis using the patient's head trauma history, combined with a process of elimination to rule out any other neurodegenerative diseases such as Alzheimer's or dementia. For a disease that is so deadly and so prevalent among athletes, there is little awareness surrounding it. To understand the prevalence of CTE, the NFL conducted a study. Scientists took 111 brains of former deceased professional football players and tested them for CTE. 110 came back positive. However, CTE is not isolated to just football. What happens if you hit your head once when you fall off your bike or head a soccer ball too hard and get a minor concussion? Regardless of the severity of the incident, our brains were not designed to undergo this type of trauma. The issue with sports is the repetitive nature of this kind of trauma and how it eventually leads to the rapid brain degeneration that is CTE. The more damage to the brain one receives, the more likely CTE is to develop later on in life. CTE occurs in 4 stages, with the symptoms getting progressively worse every stage. At stage 1, patients may be asymptomatic or only experience minor symptoms that can go largely unnoticed, such as headaches or forgetfulness. Stage 2 comes with noticeable impairment to memory, mood swings, and extreme behaviors. Stage 3 comes with significant memory loss and a general lack of emotional, cognitive, and behavioral control. Imagine that your memory always fails you, you're feeling confused, you lose your train of thought, can't find the words for your sentences. Feelings of depression and anxiety build up within CTE patients. Stage 4 is the most progressed stage of CTE, as many of the neurons in the brain have actually been killed. All previous symptoms progress dramatically. Language and motor difficulties come into play, and patients have trouble remembering even the most basic things. Over time, these symptoms cause a sense of insanity in CTE patients and can cause such severe psychological issues that the leading cause of death in CTE patients is actually suicide in stage 3. Although we may not currently have a cure to help people like my dad who suffer from CTE, I try to stay optimistic about the new developments in technology, preventative and medicinal. Even with scientists actively researching cures, we can do our part to reduce the risk and prevalence of CTE going forward. The issue isn't playing sports or the NFL or being active. It's just a general lack of awareness surrounding the issue of CTE and what happens to our heads if we continue to treat them this way. Now, I'm not saying we need to walk around wearing marshmallow hats all the time, but implementing safer head awareness measures, even starting in school athletics, can help. By protecting our heads now, by enforcing the use of helmets in contact sports, and instilling protocols to prevent severe collisions from even happening in the first place, there will be less concussive and subconcussive trauma in us as well as future generations, eventually leading to lower rates of CTE in the future. This, combined with the increased regularity of cognitive exercises in our lives, as well as the elevated funding for research, we could possibly even eradicate CTE as well as other neurodegenerative diseases within the next century. While the advancements in medicine and neuroscience are exciting, our participation on a local scale is just as important. If you know someone with CTE, Alzheimer's, dementia, or any other neurodegenerative disease, you can help them instrumentally without a fancy neuroscience degree. For me, I'm going to start off by going on a run with my dad, because exercise helps improve the overall well-being and general condition of neurodegenerative disease patients. Then we'll go on a hike, walk my dog, play some board games, and do other leisurely activities to reduce stress. And most importantly, I'll remind him to wear his helmet on the next time he goes on his bike ride. By nursing our brains with the same care that we would a torn ACL, we can change the future. Encourage your friends and family to continue protecting their heads. Continue to educate yourself and others on concussions and CTE. Be mindful of your head during your next sporting event. We can even start advocating for change right here at Moreau, even if it is something as simple as showing a 5-minute video on concussions at the start of every sports season. So let's share this information, do everything we can to protect our heads, and together, we can step into a safer headspace. Thank you.